Hey everyone, I am Akshay Kumar and you all are watching the Sedative Physio English. Here in this lecture, we are going to discuss about the cranial nerves assessment specifically for the trigeminal nerve, for the facial nerve and for the vestibulocochlear nerve. If you want the lectures in Hindi language, you can check out my other lectures, Sedative Physio, where I upload the lectures in completely Hindi language. And if you want the slides or the notes, you can simply DM me on the Instagram or WhatsApp me on the number given in the description box below. And one last thing, if you like this video, please subscribe to the channel for such videos in future. Okay, now let's start our today's lecture, that is the cranial nerve assessment for the trigeminal, for the facial and for the vestibulocochlear nerve. First of all, we will deal with the trigeminal. Now, trigeminal nerve is a mixed nerve. What is meant by mixed nerve? It basically supplies sensory. It involved in the sensory supply to the face and the motor supply to the muscles of mastication. It means that trigeminal nerve is responsible for both the sensory as well as motor supply. The sensory supplies to the face and the motor supplies to the muscles of mastication. The muscles of mastication like the temporalis, like the masseter muscle. Since this nerve is responsible for the supply in sensory as well as the motor condition, hence it is called the mixed nerve. Okay, now the trigeminal nerve has three branches. I think you all know. The first one is ophthalmic branch, second is the maxillary branch, and third one is the mandibular branch. And the trigeminal nerve also plays a very important role in the corneal reflex. So in the assessment of trigeminal nerve, we also assess for the corneal reflex. Now, the trigeminal nerve is tested for the sensation over the face. First of all, we will check for the sensation over the face. Then the motor function, the jaw jerk reflex. The jaw jerk is a reflex activity. And at last, we will check for the corneal reflex. Now, let's see how we can check, how we can assess for these all three conditions. Okay. First of all, for the sensation, simply we will normally take the patient in the sitting or in the supine lying position, and we will ask the patient to close the eyes. This is very important. The patient should not see anything. The patient's eyes should be closed. Then the therapist, it means you will touch around the jaw line of the patient, on the cheek of the patient and on the forehead, the jawline, the cheek and on the forehead lightly with the help of cotton. With the cotton or with anything very lightly, you have to touch on the jawline, you have to touch on the cheek of the patient, and at last you have to touch on the forehead of the patient very lightly. And then you will ask the patient to identify the location of the touch. Is the patient able to recognize the location of the touch or not? Okay, you have to check for this. And if the patient is able to localize the position of the touch, very good, it is very fine. If not, then it is something abnormal. Now, after this tactile, this is also called the tactile localization. Now, after this tactile localization, we can check for the pain and temperature sensation as well. For pain sensation, we can prick on the jawline, we can prick on the cheek, we can prick on the forehead, and then we will ask the patient if there is pain sensation in the patient or not. And in the case of temperature, we can go for the hot and cold temperature to check for the temperature sensations. Okay. Now, after the sensation, we will go for the motor. For motor, we will ask the patient to clench the teeth together. We will ask the patient to clench the both jaws together. And then during the clenching of the teeth by the patient, we will observe and we will palpate the bulk of masseter and temporalis muscles. Basically, first of all, we will ask the patient to clench the teeth together and we will palpate on the masseter and the temporalis muscle to check for the function of these muscles. After this clenching of the teeth, then ask the patient to open the mouth and you will resist the opening of the mouth. Okay, the patient will try to open the mouth and you, the therapist, will resist the opening of the mouth by the patient. And then you will judge for the functioning of the motor function of the trigeminal nerve. Now, third one is jaw jerk. For the jaw jerk, you have to place your non-dominant finger on the patient cheek. Just place your non-dominant finger. It should be index finger, more preferably index finger. Non-dominant index finger on the patient's cheek. Then strike your finger over the patient's chin with a tendon hammer. Just a minute, there is a mistake here. It is not patient's cheek, it is patient's chin. Extremely sorry for this mistake. You have to place your index finger on the patient's chin and then you will strike your finger over patient's chin with a tendon hammer, and then the response will be slight protrusion of the jaw. The patients will slight protrude the jaw. Okay, this is the normal jerk activity. This is the normal reflex activity of the patient. Now, after the jaw jerk, we have to check for the corneal reflex. For the corneal reflex, we will ask the patient to sit. The patient will be in the sitting position with eyes open. Here the eyes of the patient will be open and the patient will look straight. After putting the patient in this position, you will lightly touch the cornea with a sterile cotton wool. Now, sterile cotton wool is very important. You have to not use any type of cotton wool because eye is very delicate organ, so there are chances of infection in the eye. So you have to use a sterile cotton for the touching on the cornea. You have to lightly touch the cornea with a sterile cotton wool. When you will touch the cornea with a sterile cotton wool, suddenly the patient will close his or her eyelid. There will be sudden shutting of the patient's eyelid. If this action happens, then the corneal reflex is very normal. If it doesn't happen, then there is something abnormal with the trigeminal nerve functioning. Now, next we have the facial nerve. Facial nerve, as we all know, it is the seventh cranial nerve and it supplies motor branches to the muscles of facial expression. All the facial expression like smiling, like crying, like angry expression, these all are due to the facial nerve. The facial nerve control all these expressions, and facial nerve is also very important because it is related to the facial palsy and the Bell's palsy. Many of you think that facial palsy and Bell's palsy, these two are very similar, but these two have some basic difference. I will discuss it today in just a few minutes, but still let's discuss about the assessment of the facial nerve first of all. Okay, now it supplies 2/3 of the tongue. Apart from the facial expression, apart from the muscles of facial expression, the facial nerve also supplies the 2/3 of the tongue by its chorda tympanic branch. Okay, so facial nerve have a branch that is known as the chorda tympanic branch, which is sensory in nature and it supplies to the 2/3 of the tongue. That's the reason when we see any patient with the facial palsy or Bell's palsy, there is something abnormality relating to the taste sensation in the patient because of this chorda tympanic branch. Now, the facial nerve is tested by asking the patient. You will ask the patient to make a crease on the forehead. To make a crease on the forehead, it means to contract the muscles of the forehead. You will ask the patient to contract the muscles of the forehead. Then you will ask the patient to close both the eyes tightly. Then you will ask the patient to puff off the cheeks. Then at last you will ask the patient to give a glorious smile by showing the teeth. If the patient fails to do so, then there is something abnormality with the facial palsy. Now, I just discussed that facial palsy and Bell's palsy both are different. Okay, here I am writing facial palsy and Bell's palsy. Many of you think that these two are same. Many of you think that these two are the synonyms, but you are extremely wrong. Facial palsy and Bell's palsy are two different things. The facial palsy is upper motor neuron lesion. The Bell's palsy is the lower motor neuron lesion. Now, if you don't know the upper motor neuron lesion and the lower motor neuron lesion, let me know in the comment section below. I will further explain it in the next lecture. But for the current scenario, the facial palsy is the upper motor neuron lesion and the Bell's palsy is the lower motor neuron lesion. Now, what will be the difference in the appearance and the clinical features of these two, facial palsy and the Bell's palsy? So, in the facial palsy, there will be contralateral lower quadrant of the face affected. I am repeating, there will be contralateral lower quadrant of the face affected in the facial palsy. But in the Bell's palsy, complete half of the face will be affected on the same side. These two are the basic difference between the facial palsy and the Bell's palsy, that in the facial palsy, the contralateral lower quadrant of the face is affected and is termed as the facial palsy, but in the Bell's palsy, there will be a complete half face affected on the same side and hence it is called the Bell's palsy. So, these two are very different. There are similarity between these two because the muscles of face is affected in this both the conditions, but both are different. One is the upper motor neuron lesion and second is the lower motor neuron lesion. Now, after the facial nerve assessment, we have to go for the vestibulocochlear nerve. Now, vestibulocochlear nerve assessment contains many tests because it has two nerve here. First one is the vestibular part and the second one is the cochlear part, and again vestibular part has 2 or 3 assessment tests. So here we will discuss about only 2 tests of the vestibular part, and in the next lecture we will continue it to the cochlear and the rest of the vestibular nerve, and then we will move on to the next nerve. Okay, now the vestibulocochlear nerve, it is the 8th cranial nerve. It provides innervations to the hearing apparatus of the ear. It means it is responsible for the hearing apparatus. It is responsible for the hearing. It carries the auditory sensations from the ear. Okay, it also transmits information about the balance and equilibrium to the brain. It is also responsible for the balance and equilibrium of the body. Here in the vestibulocochlear nerve, the vestibular and the cochlear part, both parts of this nerve are tested separately. Here first of all we will discuss about the cochlear part, which that's main part is hearing. Cochlear part is mainly involved in the hearing. For the cochlear part, first test is the crude test. In the crude test, we have to make the patient relax. First of all, we will make the patient relaxed. We will make the patient seated in a normal and relaxed position. Then we will ask the patient to close her or his eyes. The closing of eyes is not compulsory here in the vestibulocochlear nerve. The patient will be in a relaxed sitting position, and then we will rub our fingers. It means therapist will rub their fingers next to either ear or whisper some words. Okay, the patient will be in the sitting position. You will whisper some words in the ear of the patient. You will whisper some words near the ear of the patient, and you will ask the patient to repeat. Mind it, you have to whisper the words. You have to not say it loudly. You will whisper some words near the ear of the patient, and then you will ask the patient to repeat those words. If the patient is responding if the patient is repeating your word, congratulations, your patient is very normal. The vestibulocochlear nerve is normal, and the crude test is negative. Okay, now after the crude test we have another test, that is the Weber's test. It is very important test. In fact, in many examinations in the Viva, the external also ask the students to go for the Weber test. So Weber's test is very important. It is done for the hearing. It is a screening test for hearing. It is done to detect unilateral conductive hearing and unilateral sensory neural hearing loss. What are these two? Unilateral conductive hearing loss. Sorry, it is unilateral conductive hearing loss. Okay. A conductive hearing loss basically happens when the sounds cannot get through the outer and the middle part. Okay, the sound that is coming from the outside, it will not cross the outer or the middle ear, and it will be unable to go inside the internal ear of the patient. That's the conductive hearing loss. At the same time, the sensory neural hearing loss caused by the damage to the inner ear of the nerve from the ear to the brain. So basically the sensory neural hearing loss is the damage, is the injury at the internal ear, and the conductive hearing loss is the damage or the injury in the middle or the external ear. Now, for the Weber's test, we will use a tuning fork of 512 Hz. We will use a tuning fork of 512 Hz. Now, what will be the process of the test? First of all, we will make the patient be seated, and we will explain the entire process to the patient. First of all, we will ask the patient to sit and to be relaxed, and then we will explain the entire process that we are going to do with the patient. The patient should be aware about the process. Now, after this step, you will get the tuning fork vibrate by striking at the rubber cock. Just strike the tuning fork at the rubber cock and start its vibration. After this step, after striking at the rubber cock, place the vibrating fork at the midline of the skull. You have to place the vibrating fork at the midline of the skull of the patient. Now, here is the conclusion. The sound should be heard symmetrically on both right and left ears. Mind it, if the patient is normal, there will be a symmetrical hearing of sound in the both ears, in the right and left ears. But if there is conduction loss, the sound will be heard louder on the defective side. But at the same time, if there is sensory neural hearing loss, if there is sensory neural hearing loss, the sound will be heard louder on the normal side. These two conclusions can be made through the Weber's test, that if there is conduction loss, the sound is heard louder on the defective side. But if there is any sensory neural hearing loss, the sound will be heard on the normal side of the patient. Okay, I hope you all understand this Weber test and the assessment test for the facial as well as the trigeminal nerve. If there is any doubt in this lecture, let me know in the comment section or DM me on the Instagram. I will absolutely help you. I will see you guys in the next lecture with the continuation of this lecture. Till then, be happy and keep learning.